And then let's talk about regular Verruca plana, regular flatwort. So to me, I think of EDV and this funny eosinophilic variation of it as basically subtypes of flatwort or Verruca plana. Verruca plana are not as easy to diagnose as regular Verruca vulgaris. Verruca vulgaris has, tall, finger-like papillomatous projections and in-towing of the rete. Verruca plana does not have those things. Clinically, they can be one or sometimes multiple little tiny papules, barely raised, flat-topped. They can be multiple and kind of linear because if you scratch them, they tend to Kebnerize or grow along the site of trauma. And so that happens. Shaving can spread them, or people itching at them can spread them. And what they have microscopically is slight, gentle undulation, very vague, blunted papillomatosis of the surface, hypergranulosis, kind of a thickened granular layer, and then this pattern of HPV cytopathic effect. These cells people call bird's eye cells. I don't know why. I don't think they really look like the eye of a bird, but maybe I just have not looked at eyes of birds enough. So in any case, these cells that are kind of clear, have uniform, slightly enlarged nuclei with a little nucleolus, these are keratinocytes with this unique type of HPV effect that we see in Verruca plana, also known as flatwort. So this is another example. That was a different case. Here's another case. I'm just showing a few examples. Here's one where you've got some Verruca plana here, and then focally in that same Verruca plana, you can see that blue-gray epidermodysplasia verruciformis EDV type cytoplasmic change. So regular flatwort Verruca plana over here on the left, and then on the right, the EDV subtype. So they can coexist together. Isn't that nice? I just think it's kind of fun. And sometimes when you scratch or pick the skin, you get something called lichen simplex chronicus or prurigo nodularis. And it can also have some overlap. It can get kind of vacuolated, slightly enlarged keratinocytes, slight undulation, hypergranulosis. So sometimes I have trouble actually telling apart. When you've got good bird's eye cells like this, no problem. It's going to be a Verruca plana. But sometimes I see subtle changes that look kind of like a flatwort, but I think mostly it's just lichen simplex chronicus. Occasionally I'll say, oh, lichen simplex chronicus, but there are some features there that could also be a coexistent Verruca. Like sometimes people have a Verruca and they pick it. So then they get prurigo or lichen simplex chronicus change over it. It's very common in skin for us to see people pick and scratch at their skin. It's a common thing to do. All right. And we already did the EDV. So on these posts on Kiko, I've got more resources if you're curious about EDV and Verruca plana. You can go watch. I've got other videos and examples there.